Hello and welcome to APTN National News on this beautiful Monday afternoon. I'm Sav Jonesa. Accessing affordable and timely healthcare anywhere in Canada can be challenging at the best of times, but for people who call the Northwest Territories home, there's the extra burden of navigating the medical travel system. Our reporter, Charlotte Moore-Jacobs, takes a look at how the human and financial costs of medical travel north of 60.
Sherry Kodran is leaving Hay River, Northwest Territories and traveling over 6,000 kilometers to Nicaragua for medical treatment. Living with chronic pain and mobility issues for over 3 years, she's willing to pay out of pocket in hopes of a diagnosis.
Back to November again, seeing Hay River Hospital, lower back pain, 4 to 5 days.
In 2021, she began experiencing problems with her knee, but her condition worsened while waiting for specialists and testing. In February 2023, she wound up in the emergency room in Yellowknife.
The doctors in the ER wanted me to see, they consulted with a neurologist in Edmonton, who wanted me to see that neurologist. And so the neurologist phoned me as soon as I got back to Hay River, phoned me, bam, and it's like, you're in. And I'm like, yay! It's like home medical travel. They wouldn't approve it.
Someone in the Territory's medical travel bureaucracy gave Sherry the thumbs down. The referral wasn't issued by a physician in the NWT, so it couldn't be covered under the territorial policy.
And she's like, no, you have to wait for the neurologist to come, that we have one that comes up to the territories. I could not feel my legs from the waist down.
Politicians routinely acknowledge policy and process barriers that hinder patient experience and outcomes when they have to travel for medical care. There's strict rules on who and when someone can travel with an escort, modest per diem rates, confusion over referrals, and what patients will be on the hook for financially. Even a life-threatening incident like a stroke might result in the patient and their escort being shouldered with travel costs. On July 3rd, the Standing Committee on Social Development spoke about these gaps.
Like, how do we help these people? Because it comes off as arbitrary at the end of the day when you have your doctor, your nurse, all these people pulling for you and saying, we're trying to help, we're saying this person needs to be here, and we're advocating to the medical travel coordination unit of the department to get the exemption for you. And then the administration comes back and says, no, we're not going to do it.
It's a complex, costly system. Some folks have employer-sponsored plans with GNWT and feds. There's private third-party insurance and Workers' Safety and Compensation Commission, and non-insured health benefits.
Healthcare system, okay. And for the rest of the other population with no insurance, okay, they're the ones that are losing out a lot in this whole process, especially with the medical travel.
And demand is increasing, with nearly 17,500 total cases of medical travel between 2022 and 2023 fiscal year. A quarter of those cases had to fly out of territory. These 2 Yellowknife boarding homes are at capacity and often put people up in hotels. Kodran finally saw a neurologist in Yellowknife in June 2023, but says she was told she needed to get used to walking with a cane for life.
And how many times I've been to emergency, how many times I've been, I can't even say medevaced out, they just throw me on a plane. Yeah. But I can't imagine the costs. And so Treaty's getting billed for this, I'm assuming, but yet Treaty has no control over it.
APTN repeatedly asked for interviews with the health department to discuss medical travel, but were denied. With medical records in hand, Kodran has lawyered up for what she considers negligent treatment. In the meantime, she'll seek help elsewhere.
My biggest fear is they'll misdiagnose me. My biggest fear is getting treated here. That's why I'm going someplace else.
Charlotte Moore-Jacobs, APTN National News, Yellowknife.
A gold mine in north-central Yukon has been the center of controversy after it experienced an equipment failure which led to a landslide. On Thursday, government officials confirmed the slide caused cyanide to be released into the environment, including into a creek. As Sarah Connors tells us, environment advocacy groups are fearing for the worst.
This level of cyanide in Haggart Creek could potentially affect fish. Whether this concentration of cyanide in the water will actually affect fish depends on other chemicals in the water.
On Thursday, Yukon government confirmed elevated levels of cyanide were found in Haggard Creek near the Eagle Gold mine site in central Yukon. The results came a week and a half after the mine experienced an equipment failure that caused a landslide. Government regulations allow for 0.005 milligrams of cyanide per liter. Officials say 0.04 milligrams per liter of cyanide was found in the creek.
It broke my heart to listen to the technical briefing yesterday. It was physically painful.
The concern now for many is aquatic life. This environment group says in its review of the mine, an assessment board found in some cases fish can die at lower levels than what was found in the creek.
They state that cyanide levels of 0.02 milligrams per liter can be toxic to fish. It depends on a lot of factors, but it makes a lot of sense that they brought in a fish toxicologist because this could be quite bad.
We're quite concerned, just, physiologically, we don't want to lose any fish.
The Yukon Salmon Subcommittee says Chinook salmon use the creek as a nursery and spawning ground. With Chinook stocks already in decline, there's worries any threat to their environment can cause irreversible harm.
There are hundreds of stressors against salmon, and this is one of those places where they should have refuge or they should have rest in order to spawn, and that's not happening. Now they have this additional stress.
A little bit complicated.
This mining expert says the cyanide found in the creek will likely impact fish, though he doesn't believe it's high enough to kill them. But he says no one will know for sure until there's long-term testing.
Because to see the effect in the fish in the long term, you need a sample, not just one sample. You need about 30 days sampling there.
The First Nation of Nachonayakdun is located 85 kilometers from the mine site. Chief Donna Hope wasn't available for an interview today. However, she previously told APTN her community is grieving for the lands and waters, and it will be taking swift action to hopefully prevent any more contamination. Sarah Connors, APTN National News, Whitehorse.
It's been 5 years since the final report of the National Inquiry into Missing and Murdered Indigenous Women and Girls was tabled. One Mi'kmaq woman says implementing the calls for justice has come to a standstill. Angel Moore reports.
This is the 2017 MMIWG public hearings in Membertou, Nova Scotia. Marie Sack of the Sabaganagati First Nation was behind the scenes at the time, offering support to the families. She says it was important families shared their stories.
And it gave families justice, finally, that they could speak up about their loved ones.
Sack still offers that support. She heads the Family Liaison Unit Missing and Murdered Indigenous Persons Coordinator at the Nova Scotia Native Women's Association. Sack says not much has changed since the hearings.
Because there's still a lot of work to be done and a lot of funding that needs to be distributed for programs such as sexualized violence, domestic violence, which all falls under the Missing and Murdered Indigenous Women and Girls. There's the human trafficking. There's so much that involves our missing and murdered Indigenous women and girls.
There were 231 calls to justice, but Sack says better policing needs to be at the forefront.
We need to educate the police officers within our country, and they're not getting enough. I feel that they're not getting enough to understand the Aboriginal communities in Canada.
Marion Buller is a former Chief Commissioner of the Inquiry. She says MMIWG families often spoke about mistrust of police due to poor conduct.
We had numerous calls for justice regarding proper training of police officers, of cultural training for police officers, ability to de-escalate, proper supervision of police officers once in the field.
Sack says change takes time and governments can do better.
So there's still 200 and some recommendations that have to be fulfilled within Canada. But no, I don't think it was ever a waste. I think it made Canada wake up and be aware of what was happening to our Indigenous women, the numbers.
Angel Moore, APTN National News, Millbrook First Nation.
A long-awaited water treatment plant is now up and running on the Star Blanket Cree Nation. The community has been on a boil water advisory since 2007. CTV's Mick Favel brings us this.
A water treatment plant, nearly a decade in the making, is now up and running on the Star Blanket Cree Nation. The community has been on a boil water advisory since roughly 2007. The new plant is intended to improve the quality of life for residents.
We're very overwhelmed that it's here, very emotional at time because, like I said, it's been a very long and challenging time. We're very thankful. We're very proud.
Planning for the $10.5 million project began in 2015. Now, the plant reaches 90 homes. Residents can also come and get water whenever they need it. Those who have used the new water can already see the difference.
It's nice to be able to not load up the jugs every other day, go down to the water, buy water, bring it back, and then use that. That's how we've been operating for a lot of years. So it's nice just to turn the tap on now and not have to worry about it.
Star Blanket Cree Nation did have a water plant before. It had gone through upgrades and repairs, but was unable to get the advisory lifted. There are currently operators who have worked in both water plants, and they say the people using the new water love it.
All I hear is good things about this water now. Everybody was scared to even use the water to clean their houses with before. Now they're very happy to know that they could drink the water right from the tap.
There are still a few touch-ups that need to be done, like some fencing around the area, as well as grass, which will be installed in the coming days. But the water plant is now fully operational, hopefully for many years to come. Mick Favel, CTV News, Star Blanket Cree Nation.
We need to take a quick break now, but stick around. We'll have more stories coming up soon. Welcome back. The village of Alberta Beach, about 70 kilometers northwest of Edmonton, and their Heritage Museum held an event recently called A Bridge Between Nations. The village and museum worked with the nearby Alexis Nakota Sioux Nation to unveil a teepee as their newest permanent exhibit. Alexis members and elders told stories of residential schools, the pass system, and the 60s scoop to locals in attendance and government representatives from all levels. The teepee will help educate visitors to the history of the Alexis Nakota Sioux people.
And so today marks a beautiful day of building a bridge. And the bridge in such a small teepee or this museum is just like a ripple. From that, because we have everyone here from the different governments, that ripple should carry to all of those tables. And as you carry to all those tables, you have to create that space for the First Nation to be there. And in doing that, we will continue to grow together.
The RCMP in Saskatchewan say they're eliminating barriers and creating opportunities for Indigenous people in remote communities who want to join the force. When applying to be an RCMP regular member, one requirement is a valid CPRC and first aid certificate. In remote communities without these classes, traveling for training is expensive. The RCMP Indigenous Recruit Unit is removing that barrier. They covered travel and accommodation costs to bring 11 prospective recruits from remote communities to Saskatoon, where training in CPRC and first aid was provided by current members of the RCMP who helped the recruits pass the course. And the fly-in community of St. Teresa Point, Anishinaabe Nation is celebrating their 42nd annual Bannock Festival. This year has been the biggest one yet, including flying in some big-name artists like Johnny Reed and Mariana's Trench to give free concerts for the entire community. APTN was invited to the community in northern Manitoba, and we bring you a sneak peek now.
Johnny Reed, where you at? There's a lot of love here for me. I'm in love for sure. I'm in deep.
life is beautiful here. You know, you've got people that celebrate each other. You've got people that love their children. You've got people that celebrate their elders.
Other not only Bannock but other food that they're cooking, and it's really good.
I've eaten more Bannock today than I have in 10 years. It's been great.
So good to see you. Dance with me. I got Bannock. I got Bannock. I never thought I'd ever get here. But it sure feels good to be in St. Teresa Point tonight.
A really huge thing for me and for the boys because of how much we love the music.
Take it back to my body and my way. Give for the world, give my soul.
I hope the mosquitoes don't eat you alive.
Join us starting tonight and all week long for more stories from St. Teresa Point. We need to step aside now for one last time. See you in a couple minutes. It'll be 23 in St. John's and Charlottetown, 27 in Happy Valley Goose Bay, and 25 in Cartwright. Montreal is 26 and 24 in Quebec City. Ooh, it's sun and 28 in London, 28 and some cloud in Toronto. 24 in Timmins and 16 in sun in Big Trout Lake. Puckatawagan is a sunny 25 and some cloud and 12 in Churchill. Gimli is 21 and sunny and 22 in sun in Barons River. 20 and cloudy in Regina, 22 in sun in Yorkton. It is 18 in Stony Rapids and 21 in Buffalo Narrows. 24 in sun in Fort McMurray, 20 in Peace River. 23 in sun in Medicine Hat, and it's a sunny 19 in Edmonton. Vancouver is sun and 20, and 14 in Bella Coola. Fort Nelson is cloudy and 18, and sun in Prince George, 16. Mayo is 12 and 15 in Watson Lake. Yellowknife is cloud and 17, and Fort Simpson is 16. Colville Lake is 7, Sax Harbor is 2. 11 in Chesterfield and 7 in Cambridge Bay. Iqaluit is 4 and some cloud and 10 and some cloud in Resolute. The Government of Canada recently launched a new interactive mapping tool. It's an environmental scan report of the 140 former residential schools recognized in the Indian Residential School Settlement Agreement. Indigenous Services Canada says the new tool will help survivors and communities heal from the pain and trauma caused by residential schools. David Russell is the National Coordinator for Residential Schools with Indigenous Services Canada. Dennis spoke to him on Friday.
David, thanks for being with us. Can you tell us about this new mapping tool and what is included?
Sure. So the Indian Residential Schools interactive mapping tool is part of our broader strategy to make information about residential schools more accessible to survivors, their families, and communities. We put together information from an environmental scan on the current status of the former 140 residential school sites across the country and used existing publicly available data and making it into a more accessible format through this interactive mapping tool. It has historical air photographs to overlay with modern satellite imagery to give the viewers the opportunity to see the locations of former resident schools, how they are situated in terms of other communities where students were taken from, and to be able to look at some of the jurisdictional aspects of the lands that are involved.
Why was this something that Indigenous Services Canada wanted to do?
Well, it speaks to the broader commitments to support Indigenous data sovereignty, to make government data more accessible to the public, to survivors and communities. It's part of the action plan under Canada's United Nations Declaration on the Rights of Indigenous Peoples Act. It's our commitment to responding to the Truth and Reconciliation Commission's calls to actions, and really to respond to the requests from communities and survivors about information on residential schools to be available, to be more accessible.
Minister Patty Hajdu said in the press release that the new tool would empower survivors and communities in their journey toward healing from the pain and trauma caused by residential schools. Can you tell us how that would, how this helps?
I think having tools like this that give a visual representation of where the residential schools were situated allows survivors, their families, communities to share that experience together. Each survivor has their own lived experience, but having the historical air photographs overlaid with modern satellite imagery can give them a sense of where they were taken from, how they got to the schools, where the schools were located in terms of the isolated, sometimes locations, and the current state of those lands.
It was also mentioned that this will support Indigenous data sovereignty. Can you tell us how that would work?
One of the key elements of Indigenous data sovereignty is ensuring that government information is more accessible to Indigenous peoples to support self-determination, self-government goals overall. But overall, the purpose of making this available to support Indigenous data sovereignty is really putting technical data that is publicly available, but just making it more accessible to communities and survivors.
David, any other projects you're working on that you can tell us about?
Along with the interactive mapping tool, we undertook an environmental scan on the current status of former residential school sites and buildings. That report is also available on the Indigenous Services Canada website. It details the jurisdictional ownership aspects of the 140 Indian resident schools recognized in the Indian Resident School Settlement Agreement. Those schools occupied 174 sites across the country. So this report and the map together give a full spectrum of the truth and facts elements around residential schools.
David, we'll leave it there, but appreciate you taking some time to talk with us about this.
Thank you.
And that's all the time we have for this afternoon's episode of APTN National News. I hope you enjoyed the stories our reporters brought to you today. If you're looking for more news, please visit our website at aptnnews.ca and check out our newscast later this evening. I'm Sav Jonesa, and from all of us here at APTN, thank you so much for joining us.